Hi, I'm Dr. Michelle Ascar, owner and operator of the Beaver County Spinal Disc and Neurology Center. Thanks for stopping by. Today, what I wanted to talk about was degeneration of the spine, whether it's the neck, middle back, or low back. So what I'd like to do is turn your attention to this model. This model right here is a representation of two vertebrae in the spine with the disc in the middle and the nerves coming out of the side. So a condition that brings patients into my office most commonly is a condition known as bulging or herniated disc associated with spinal stenosis. So let me explain to you what those actually mean. When you look at this model right here, the gray area in between the bones known as the disc actually acts as the shock absorber for our spinal column. And if I were to take multiple pieces of this model and stack them on top of each other, you can see there's a disc in between each bone known as the vertebrae. Now, over time and with certain injuries, what happens is these discs begin to degenerate. And when they degenerate, what begins to happen is they start to put pressure on the spinal nerves. So depending at what level that is occurring, we may experience things such as headaches, numbness and tingling in the arms and hands, lower back pain, numbness and tingling in the legs, ankle, feet, or toes, or a very common condition known as sciatica. So my job when an individual comes into the practice is to determine their overall spinal health and what is actually causing their problem. When we determine and diagnose what that problem is, for instance, a bulging or herniated disc or spinal stenosis, then we are better able to help the patient alleviate that discomfort and sometimes permanently take that condition from a bad situation to better. So again, looking at this model, this would be an example of what a normal healthy set of vertebrae should look like. The bones are very smooth, the discs are very healthy, the nerves coming out of the side of the spine here, the hole is wide open that nerve is coming out of. When we go into what's known as a stage 1 of degeneration, what begins to happen is there's pressure being put on the disc, and that disc actually begins to bulge out. Okay? Now, as this problem becomes worse, we move into what's called a phase 2 of degeneration. Now you can really begin to see the wasting away of the bone. The disc is bulging out to a very moderate degree, even going toward the spinal cord and sometimes the spinal root, or even a combination of both. You also begin in a phase 2 of degeneration to get lipping and spurring of the bone, which is known as arthritis or osteoarthritis, which creates a lot of pain and discomfort as well. Lastly, if that problem is left undetected and uncorrected for quite some time, the body has no choice but to move into what's called a phase 3 of degeneration. Unfortunately, when an individual gets to this place, sometimes surgery isn't even a solution for that individual. So my goal when a patient comes into our practice is to catch them when they are in one of these 3 situations, because when they are, I know my ability to take them from a phase 2 or a phase 1 back to a normal healthy spine is much greater. So if you have any additional questions or concerns, or would like to contact the office for a complimentary consultation, please do so by calling us at 724-709-7709 to see if this is something that is causing your sciatica and or low back pain. Thanks, and have a great day.